Hey, welcome to another Topic Tuesday. Today I'd like to demonstrate a little bit about applied kinesiology and how it can help in some cases. I have my lovely assistant, Maddy, who just started working with us. She's a superstar. And she volunteered to be a patient today in the video. And I haven't really had a chance to treat her except minutes ago. But I was asking her questions. She's been in sports her whole life. She's injured herself all over the place. It was kind of a little scary. So I was like trying to narrow down, like, what can I help her with? And you had a motor vehicle accident how long ago?
It's been 3 years now.
3 years, okay, and you got hit from behind?
Yes.
Okay, and when you got treated with chiropractic?
Yes.
What was the things that you had done?
I was in physical therapy and chiropractic for about a year.
Okay, and it got better, obviously. And now you still have some stuff?
Yes.
Okay, and we were talking earlier, and I asked the modifying questions, and it was worse towards the end of the day?
Yes.
No matter if you were sitting or standing?
Yes.
And so that made me think of the postural muscles that help with standing, but also if patients are worse at the end of the day, a lot of times you want to look at the adrenal glands. Worse in the morning is something else, worse at the end of the day could be feet or the postural muscles of standing or standing upright. And from that discussion, I asked her to bend forward, in which you can bend forward and touch your toes. And that doesn't hurt, it actually feels like a nice stretch, but when she arched back, that's where she has that consistent pain. So it made me think, if you guys are AKers, we had an imbrication problem. And so before the video, a lot of times in AK, I got to clear out the nervous system because it might give me false readings. And so because I'm using her body to diagnose herself, I got to make sure I'm getting the right information. So as I went through that, I actually adjusted your L4. But she got up from the table and still had pain. So I went back, and you guys are all cut up, and this is where I am. So I'm going to have you lay face up. When there's pain going back, and we just think of purely muscle, it's the muscle doesn't like to do that. If it feels good going in a certain direction, then you want to use that as a way of going, why is that? So with AK, I'm allowed to at least ask a couple more why questions in a treatment session. So if it hurts to go back, I'm thinking that the muscles that bring her forward aren't working, and the muscles that are bringing her back are overworking, and the reason for it is the body is having difficulty managing it. So I'm going to look at the muscles that bring her forward first. So this is iliacus muscle, and that's weaken to clear and push up, and that's psoas, weaken to clear. I also want to check glute medius, push out, so drop it down, push out, push out. That's fine. So the muscle testing, I'm just pushing on the muscle, and if it locks, it means it adjusts to my pressure. And push up, and push up. So this psoas, push up. And the psoas and the iliacus are strong here, so I really, to focus on how am I going to help her, I have a great window into these two muscles on her left hip. And knowing what I know through my experience, I'm going to put her hands in areas of her body and see, does it change the muscle? I'm using her body to diagnose herself. So she's going to take her hand, and my best guess is L3. She's going to touch right here at L3. I'm going to retest these muscles, and it doesn't help her. Then she's going to take her hands and touch C3 on both sides. Go ahead and touch. And push up. That doesn't help her. And I should have done two hands on L3. Let's do that. Take both hands, touch right here and here, and push up. Nothing changes. So I'm kind of running out of options. There's other areas of the spine, but I want to go ahead and jumpstart, because in applied kinesiology, we're using muscle testing, and we're using all the different forms of healthcare that we can possibly do. And there's a reflex point that was discovered in 1930 for kidneys. But later on in applied kinesiology, we found that those organ-related reflexes actually affect specific muscles. So the one for iliacus psoas is 1 inch above and 1 inch outside of her belly button. So where's your belly button? I'm going to actually have her touch that and push up, and push up. So the body's telling me that would be the best direction to go. So I would rub that reflex point. And what it does is it causes lymphatic drainage from the organ as well as the muscle. So that might be one of the things that's happening, because she's still, despite having great care, still having problems. We just want to look a little deeper into the situation. So But I have a great opportunity with finding that, is there some nutrition or something that we can give to her kidney? Now, I asked her earlier if she had any kidney problems. She had no kidney infection. She goes, I don't remember, maybe I was a kid, I didn't have it. I go, we don't have to go that far. And then one of the things that affects these muscles the most is dairy, and she says, I don't do dairy because I'm lactose intolerant. So I started scratching my head and thinking, well, what can I give? And so one of the products that I grabbed from Standard Process was Arginex. Now, the tongue is a chemical receptor, perceived as taste, just like your eye is a light receptor and you perceive sight. I'm going to actually put this on her tongue without her touching this, and if this makes this muscle strong, then I want to support her. I think this product costs $15 or 14. Yeah. So she's going to put that on her tongue, and I'm led here because of that reflex point. Push up and push up. Okay. So I'm going to get that off her tongue. So right now, I'm going to have her stand up, and she's going to arch back and tell me if she still has pain. It's because the muscle testing helps me find things, but it doesn't, I don't know if I fix things. You still feel pain going back?
No.
Okay. Lay face up. So I think it's part of that is the supplement. I'm going to go ahead and rub this, and then how I would treat it is I would give her Arginex. Sometimes you can have more than one thing, and that one thing may be the thing keeping your body from fixing things completely. It either is going to be found with muscle testing or some other means, but I really, 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 really am trying to educate all of my fellow human beings that the body can fix itself. You just got to figure it out. So never give up the fight. Look into things. Trust your intuition. It's okay to go to Dr. Google and look for ideas, but don't go to Dr. Google to figure out is it the right choice for you. You're just going to have to sit with it. Thanks. I'm going to rub these points. They're going to be tender, but she's tough. Maybe. We'll find out. I never got to do these on her before. They're kind of ticklish and tender. I had a friend named Whiskey Sam. He was my boonie ride buddy for a year and now. He said my country got a little off track. Took him 25 years to welcome me back. So I'm going to recheck those muscles. Push up. Good. Retouch it. If it re-weakens, the body says I got to do more. So with applied kinesiology, you can look at it any way you want. You can look at it with complete dismay. It doesn't matter. My brain tends to work in many places at once. Some people call it ADD. I call it strikes of lightning, of genius as well. You know, why not paint the best picture? So it could be romantically, I'm asking her body what's wrong with it. Isn't that amazing going to a doctor, tell him what's wrong, and he tells you back in Latin? Or you can have the doctor go, could be this particular name in Latin. Let's ask your body what's wrong. So that is one of the approaches I would look at with chronic low back pain. Or chiropractic works, acupuncture works, massage works, but I still have a problem, is how we do it. So before, when you went back, you had pain, and now you don't.
Yep.
Isn't that cool?
Yep.
We'll see you next Tuesday.